have certainly heard some amazing talks around social determinants of health, vulnerable populations, economics and policies as they affect health equity. So now what we're going to do is shift the paradigm towards social accountability, and we're going to give you a brief talk about this. So our objectives are, we are going to exemplify the limitations of metrics today. So I'm going to reiterate some of the conversation that was discussed this morning. And then we're going to offer a framework that I hope you will agree is a coherent, structured, compassionate framework of equity and empowerment. And then we're going to start a process of finding metrics that move us toward social accountability. So we live in a world where we're inundated with data, or certainly information at least, but we are talking today about metrics that matter, and for me, the way I'm defining this is data that we are intentionally defining, tracking, and responding to. So I'm just going to give you a case that I hope will resonate with all of you who are clinicians here. So let's say AB is a 6-year-old girl living in Cincinnati with a history of asthma. She's presenting to the emergency department with worsening cough and wheezing. Her oxygen saturation is low at 91%. She lives in a low-income housing with her mother and baby brother. And the family medicine team arrives to consider admission to the hospital. This is notably her third visit to the emergency department in the past 7 months. Her family medicine team is a 4th-year medical student, 2 residents, the family medicine attending, who are all white except for one member who's Japanese American, and notably our 6-year-old patient is an African American girl. So what are the metrics today that we are using in primary care in this case? And Lloyd Mitchner's already laughing at this. So here are HEDIS performance measurement metrics for which many of our paychecks are attached to, right? So this is what 90% of America's health plans are measuring as thinking this is how, are we performing well? And these are the measures that we're being held accountable to. As you can see, it's all around medication use, vaccination use. There is something around smoking. And then when they're revising in 2015, it's more about medication use. And the bottom, which is relative resource use for people, is basically utilization of the healthcare system. There's nothing at all upstream about this. So our clinical learners on this team, they think, my gosh, I have to learn the 440-page asthma guidelines by the National Heart, Lung, Blood Institute, right? That's what they're being incentivized to focus on by those metrics. So we know that this is not what's going to get us to health equity after all our conversations for the past day and a half. And this was an article that Lloyd Mitchner and Viviana and others have mentioned in the past 24 hours. So if you're living in Cincinnati, it is housing code violation density that seems to be most associated with hospital use and ER use for children with asthma, right? So we're not tracking that metric formally in any way. Similarly, although we may have data around this, we are not intentionally tracking this metric, that Cincinnati public school system is 25% white today, and why is it that this girl is cared for by providers who don't look anything like her? So we would like to move the discussion toward social accountability. So I'd just like to spend a moment on this slide. So this is the work of Charles Bolin, who is one of the thought leaders on social accountability in medical education. He works with the World Health Organization. And I want to share with you the social obligation scale. So most of us are working in healthcare institutions that are socially responsible, right? We are community oriented. Faculty are trying to perhaps define our institutional objectives. We do what we think are good deeds. We're process oriented. We're trying to evaluate things internally. Some of us have the privilege of working at institutions that are socially responsive. That's your middle column there. Here we have more data-driven objectives that are being developed. We might be community-based. We have competencies that we can check off to meet criteria of professionalism. We're more outcome-focused. Assessors are external. Few of us are actually working in institutions that are truly socially accountable. So look at that last column. This is where your objectives are actually defined by the people, right? Educational programs are fully not just community-based, they're fully contextualized, and We are not merely checking off boxes of competencies, we have educated change agents, which was mentioned this morning. And if we were looking at, for example, a logic model, we're not just talking about processes and outcomes, we're talking about impact, right? And then the assessors are our health partners. So just to say again, social accountability is absolutely dependent on teamwork, on partnership. With the people being at the center, you can see health professionals are only a corner of the team, right, as are academic institutions. Policymakers are critical in this, and we have to figure out a way to collaborate with all of these partners. So I just want to say that there are clearly many thought leaders who are trying to move us toward health equity. This is from the Institute for Healthcare Improvement, IHI, and they are outlining 5 key components of the framework. And I just want to focus on the top 2. So number 1, before we start thinking about strategies and any interventions, we have to state intentionally that health equity is a strategic priority. And secondly, we have to have structures and processes to support health equity work. This is from the Robert Wood Johnson Foundation. They outline a roadmap to reduce disparities, and there are 6 steps to this one. Again, if you look at the top 2, it has to become an assumption that quality and equity are the same thing. You have to start with that premise, and we need to create a culture of equity. So how do we begin the process of developing socially accountable metrics or measures? And I have the great privilege of introducing to you the next speaker of this talk, who is Sonali Sangeeta Balaji, who is coming to us and going to be sharing with us the Equity Empowerment Lens, for which she is the lead author. This remarkable work is homegrown here in Multnomah County, where Sonali was working with the public health department here originally. She now is at UC Berkeley with the Haas Institute, doing remarkable work there, looking at the intersection between belonging, spirituality, decolonization, and community well-being. So I'm going to turn this over to Sonali, so thank you.